Dr. Stacey Kahn is an attending gastroenterologist at Boston Children's Hospital and assistant professor of pediatrics at Harvard Medical School. She received her BA from Washington University in St. Louis and her MD from New York University School of Medicine. She completed her pediatric residency and pediatric gastroenterology fellowship at the University of Chicago. She performed the first ever colonoscopic fecal microbial transplant on a pediatric patient with C. difficile in 2012. Her research focuses on inflammatory bowel disease, C. difficile infection, and microbiome-based therapies, including FMT. She is a nationally recognized expert on pediatric FMT and has published numerous papers and chapters on the subject. In her role at Boston Children's Hospital, she is a member of our IBD Center, our Inflammatory Bowel Disease Center, and she's the director of the FMT and Microbial Therapeutics Program. She is an expert in IBD, the microbiome, and a pioneer in pediatric FMT, and we are so privileged to have Dr. Kahn share her experience and offer important insights in her presentation, Looking for Answers, the Microbiome in Autism.
Hello. I'm Stacey Kahn. I'm a pediatric gastroenterologist at Boston Children's Hospital. There, I focus on the study of gastrointestinal diseases and microbiome-based therapies in the treatment of GI disease. Today, we're going to be looking for answers in the microbiome in autism. These are my disclosures, and of course, some important disclaimers on this topic. Fecal microbiota transplantation is not a universally approved therapy, and in fact, its regulatory status varies from country to country. In the United States, the FDA considers FMT both a biologic and a drug, and therefore you need special permission if you're using it for conditions other than Clostridium difficile. We do have a special exception in these cases. However, for indications other than C. difficile or for FMT research, you need to obtain FDA approval with an investigational new drug application. Our learning objectives are as follows. I'm hoping that you will gain an understanding about the role of the microbiome in human health and disease. We'll review the fundamentals of FMT, and we'll learn about recent studies of FMT in autism. I wanted to start off by sharing a little bit about the microbiome and really what a tremendous, important part it is of the human body. I really like this slide from the Alimentary Pharmacobiotic Center in Ireland because it really gives a good sense of how vast the microbiome is. So there are over 100 trillion organisms that make up the gut microbiome, and 95% of those are contained within our GI tract. We know that the microbiome cells outnumber our human cells by about 150 to 1. If you could weigh the microbiome on a scale, it would probably weigh about 2 kilos in an adult, and it would take up more than 2 tennis courts if you could lay it out flat. And if you laid it end to end, it would be able to wrap around the earth at least 2.5 times. The other thing that's really important to understand is that each individual has a microbiome, and it is as unique as an individual's fingerprint. There are many vital functions of the microbiome. It promotes fat storage, it promotes the development of new blood vessels, it helps train and develop our immune system, it is responsible for the biosynthesis of vitamins and amino acids. It helps us break down and metabolize therapeutics and drugs. It is important in the way it acts on the nervous system, which will be a focus of our talk today. It's important to help us digest and resist pathogens and unfriendly bacteria in the environment. It helps protect our intestinal lining from damage, and it even helps modulate bone density. I wanted to share with you a broad overview, giving you a sense of how many different microbial communities exist within the human body. Each color in the pie graph represents a different community of bacteria: blue actinobacteria, red Firmicutes, green proteobacteria, purple Bacteroidetes, yellow cyanobacteria, and orange fusobacteria. What you can see is that these bacterial communities vary depending on the location in your body, but in general, humans have a predominance of the Firmicutes and Bacteroidetes in their gastrointestinal tract that is responsible for keeping us healthy. There are many factors that influence the microbiome, and we'll be talking about some of those today. Just to give you an overview, they include host genetics, how much you exercise, your stress, any medications, especially antibiotics that you might take. The aging process affects our microbiome. Our digestive and gastric motility affects it. We have antimicrobial peptides and gastric secretion. Our diet plays an important role, and we'll talk about that a bit today. The way in which you're delivered into this world and even where you live makes an impact on your microbiome. The developing microbiome is truly incredible, and we now understand that this development may begin as early as in utero with placental factors that impact the developing fetus. At the time of delivery, we see that there are important factors related to how you come into this world, when you come into this world, and then a number of postnatal factors that are really critical for healthy human development, including what you're fed, breast milk versus formula, your geographical location, family members and their health status, interactions with the outside world, your maternal diet, and the time of weaning and introduction of solid foods. I wanted to take a step forward and really highlight why what we eat is so important. And I know that this is of great interest to this audience, as it is to many people. And everybody wants to know, what is the healthiest diet I can eat for my microbiome? And this is a complex figure, and I'll talk you through it. But at the top, we can see that there are 5 different diets: the vegetarian diet, a gluten-free diet, a ketogenic diet, a low FODMAP diet, a Western diet, and a Mediterranean diet. And what you can see is that each diet has a unique impact on the microbiome, which is shown down at the bottom. And this is designed to represent your intestinal epithelium. And you can see that when you are on a vegetarian diet, you have increased microbial diversity, you have a healthy, intact barrier, you have normal inflammatory proteins. However, on the Western diet, which we all very much enjoy eating, but maybe not so good for our microbiome, we see that there is a decrease in that microbial diversity, a breakdown of that epithelial barrier, and an increase in pro-inflammatory cytokines that may be detrimental to the human health. If someone had to ask, what's the healthiest microbiome diet you could follow? Probably the Mediterranean diet, although there's a lot of good evidence that vegetarian and vegan diets, as long as you get all of your nutritional requirements, can be great. But what you can see is that even diets that are often perceived as healthy, such as the gluten-free diet or the low FODMAP diet, which may relieve certain symptoms, may not be the best for your microbiome. What happens when your microbiome gets disrupted? So the terminology for that is dysbiosis, and it's truly a disruption in the normal balance of bacteria in the gut. You can see on the figure on the left, we have gut homeostasis, which shows the healthy bacteria, which are very diverse, many different kinds with normal proteins. And then you can see again these epithelial cells. These are the lining of your intestinal tract, and their job is to help keep bad bacteria out and help you digest food and stay healthy. And you can see there's a healthy mucus layer, and that this situation allows humans to develop a tolerant immune system. And that happens in the setting of the healthy diets we just talked about, perhaps in the setting of probiotics and prebiotics, as well as fecal transplant, which we'll talk about. Conversely, in the setting of dysbiosis, we get a bloom or an expansion of these unhealthy bacteria, and they cause damage to our digestive tract with a breakdown of that nice healthy barrier, a loss of the mucous membrane that surrounds and protects those epithelial cells, and a truly dysregulated immune response. This is incredibly important when we think about the gut-brain axis in autism, and there are many different figures that have been proposed to explain the complex relationship between the gut microbiome and the brain. And unfortunately, we don't have all of the answers yet, but just to think broadly, in a typically developing human, as we saw, we have a nice diversity of bacteria with a low predominance of pathogenic bacteria. However, in individuals with autism, we have a dysbiosis that may be affected by diet, medications, other medical issues in that individual, geographic location, and the presence of GI symptoms, which are incredibly common in individuals with autism. So let's move on to talk about FMT. FMT, or fecal microbiome transplantation, is the delivery of an entire microbial community from an individual who is healthy to an individual with a disease. It involves extensive screening of that donor. In fact, they have to complete a questionnaire with over 150 questions about their past medical, surgical history, social history. And then they go through blood screening and infectious screening in the stool. And it turns out that it is incredibly difficult to donate fecal matter to keep it safe. And those acceptance rates into stool bank programs are less than 3%. Conceptually, we can see that in this harvested or collected fecal matter, we have a nice diverse microbiome that then gets transferred via enema, colonoscopy, enteral tube into the colon and helps restore that healthy, stable gut microbiota. I also wanted to share with you some of the logistics of FMT because everybody asks, can you do this at home? And I'm going to say this more than once. No, this is not something to be done at home. In the lab, we prepare a dose with 50 to 100 grams of stool. It can be from a directed donor, though most individuals now use a stool bank because it's the safest way to make sure that our patients don't develop complications from this treatment. The material is then diluted and filtered and then processed to a dose volume of about 30 to 250 ml, and it can be delivered via an enteral tube, an upper endoscopy, a colonoscopy, enema, or even capsules. And you can see here that the current cost for one of these cryo bags is almost $1,700, sometimes covered by insurance, sometimes not. And again, do not try this at home. I wanted to move on to talk a little bit about FMT in clinical trials. And unfortunately, due to time limitations, I can't cover everything today. But I wanted to highlight a few studies which I really think emphasize the importance of the microbiome in children and in children with autism. So first, conceptually, we need to understand what FMT does to the gut microbiome. So FMT in individuals both healthy and those with other infections like C. difficile, the FMT corrects the dysbiosis, meaning it leads to a restoration of the healthy bacteria. It increases the diversity that we need to keep us healthy. It decreases the pathogenic bacteria. And what we see is that transplant, that engraftment, that uptake of the new microbes is sustainable for up to 24 weeks. These are a little bit complicated figures, and I'm going to talk you through them. So here shown on the left is a stool donor and an individual pre-transplant or pre-FMT. And you can see that they're being evaluated on how much microbial diversity. And you can see that the donor has a high diversity. However, the patient or pre-FMT individual has a lower diversity. Once we do the FMT, you can see that there's a marked increase in the bacterial diversity, and it resembles that of the donor. If we want to take a closer look, we can look at the figure on the right. And here again, we come back to those color bars, which represent different phylum of bacteria. And again, to remind you, the Bacteroidetes are the blue and the Firmicutes are the green, and those are the ones we want the most. And you can see in our healthy donor, we have nice, broad, long bars of green and blue showing a healthy microbial composition. Our individual with C. diff, shown in the middle pre-FMT, has a complete destruction of the normal microbial communities with an almost complete absence of Bacteroidetes, or the blue bars, very little firmicutes or green bars, and a real predominance of the protobacteria, which contain many pathogenic bacteria. Following the fecal transplant, in the far right, we see that post-FMT, there is this engraftment or uptake of the new microbes to lead to a healthier, sustainable microbiome in the individual who was transplanted. This is a really interesting article which shows how important the FMT might be in the developing infants. And so this group took maternal FMT that was collected several weeks before delivery. And then they looked at the microbiome in vaginally delivered infants and found that there was a nice predominance, again, of the Bacteroidetes and the Bifidobacteria and the Firmicutes. And they compared that with individuals who had undergone C-section. And again, we see this bloom or this expansion of these pathobionts or pathogenic bacteria. And in those individuals, they delivered FMT that had been collected from the mom pre-delivery. And they looked at 7 infants who were born via cesarean section. And they received this dilute maternal FMT taken 3 weeks prior to delivery. They had no adverse events in the 3 months of follow-up. And what they found is that post-delivery of this FMT material, that infants who had been born via C-section had a new microbiome that more closely resembled that of vaginally born infants and had increased diversity. Again, in this setting, the FMT material was screened extensively before delivery to the infants to ensure safety. Moving on to think about FMT as a treatment for autism, many of us were incredibly excited to see this study that came out by Kahn and colleagues in 2017. And this was a study that was published in the Microbiome Journal, and it was an open-label pilot study to demonstrate proof of principle, or the idea that FMT might be helpful in individuals with autism. And they took 18 children with autism spectrum disorders from age 7 to 16 years with moderate to severe gastrointestinal symptoms: constipation, diarrhea, reflux, pain. The individuals then received antibiotics, followed by either a high-dose oral or rectal FMT, and then followed by low-dose oral FMT for 8 weeks. And again, this is not a blinded study. Individuals knew what they were receiving. The controlled group was an age and gender-matched neurotypical children who did not have gastrointestinal symptoms. And the results were really quite exciting, and we saw an 80% reduction in GI symptoms and an improvement in behavioral symptoms. So again, this is a complicated graph, but what it shows is the Gastrointestinal Symptom Rating Scale, or GSRS. And this is a common scale used in many studies to evaluate the severity of GI symptoms, particularly in children and adults with autism. And what you can see is that at week 0, prior to FMT, individuals had a much higher gastrointestinal symptom rating score compared to post-transplant, where the curve had nicely come down and there was a marked decrease in both these GI symptoms and the behavioral symptoms. What was really exciting is that after the initial study, Kahn and colleagues followed up with these patients 2 years later. And most of them had had very few changes to their diet, medication, or supplement regimen. What was really remarkable was that at 2 years post-FMT, these individuals had a 58% average reduction in their GI symptoms. And this is again shown by the Gastrointestinal Symptom Rating Scale. And you can see at the first box on the left that they had high GSRS scores, and that 2 years post-treatment that was significantly sustained. They also reported that individuals had a reduction in the number of days with abnormal stools, meaning that the stools were either too hard or too soft. They also went on to look at the behavior in these individuals at the 2-year time point. And this was based on parent rating scales. And what they found impressively was that there was a decrease in autism severity behaviors based on the Childhood Autism Rating Scale, or the CARS, from 83 to 17% at 2 years post-follow-up. In fact, some of these individuals, as shown in the blue bar, had little to no behavior symptoms related to autism 2 years later. Really exciting data. They also found that there was a decrease in parent-rated SRS, or social responsiveness, so that at baseline, most of the individuals had a clinical diagnosis of autism spectrum disease. However, at the end of treatment, and even up to 2 years later, you can see that there was a marked improvement in the functioning as well as in meeting the social responsiveness that was considered normal or developmentally appropriate. So this study affirmed that not only do you get a marked improvement that's sustained in GI symptoms, but that we also may have a sustained impact on behavioral symptoms in autism. The next study I want to share with you looked at FMT as a treatment for GI and autism symptoms in an open label manner. They took 40 children ages 3 to 17 years old who had both autism spectrum disorders as well as GI symptoms. They also looked at 16 age and gender matched controls of neurodevelopmentally normal children and who did not have the presence of any GI symptoms. The healthy controls had no interventions and were observed for 12 weeks. Those who had undergone intervention included 27 children who received oral FMT freeze-dried capsules weekly for 4 weeks, and 13 children who were unable to swallow capsules received colonoscopic delivery of FMT weekly for 4 weeks. In this study, what was really nice was that they only used a single donor, so there wasn't the potential confounding or confusion that comes from using multiple donors in a study. And they also confirmed that the bacterial dose in the stool material delivered, or FMT, was 2 × 10 to the 14th colony forming units, so making sure that each individual who got this donor material got the same amount. And again, what they found was that GI symptoms had decreased in a significant way. So again, here we're looking at the Gastrointestinal Symptom Rating Scale, the GSRS, and you can see that at baseline, or week 0, the GSRS was quite moderate, and that they had a marked decrease by 4 weeks of post-treatment. And that included a decrease in symptoms including stomach pain, reflux, constipation, and indigestion. They also had a significant decrease in hard or constipated stools and a significant decrease in liquid stool. And what was really exciting is, again, they found that this benefit to gastrointestinal symptoms was really sustainable for up to 12 weeks after treatment. They also found that FMT may improve autism behavior in the short term. They found, similarly to the prior studies, that there was a 10% decrease in the CARS score immediately after FMT, and that there was a 6% improvement in the CARS, or behavior related to autism, through week 8 follow-up. They also found that there were improvements in social skill deficit. Unfortunately, they found that many of these were transient and were reversed by the end of the follow-up. They found no differences between the individuals who received the FMT orally versus those who received the FMT colonoscopically. But I do want to highlight that there were some adverse events, including individuals who experienced worsening GI symptoms, as well as some reports of hyperactivity and aggression following FMT. So clearly more studies in this area are warranted. I want to spend the last couple of minutes talking a little bit about adverse events. You've heard from me more than once today that FMT is not a therapy that should be done at home. It's really something that should be part of a large clinical trial or with your doctor's supervision to ensure that it is safe. Minor side effects or adverse events include abdominal pain, diarrhea, bloating, or constipation. We can also see procedural complications that are related to how the FMT is delivered, which include aspiration or perforation, which is a small tear in the intestine. And really, of course, the concern, particularly about home FMT, is that there are significant risks of infection, including CMV or cytomegalovirus, listeria, which can be life-threatening, aspiration pneumonia, as we talked about, sepsis. And even more recently, there was a tragic case of a few individuals who were part of a trial for FMT in immunocompromised, and they were delivered FMT material that had been extensively screened, but unfortunately had not been screened for this resistant E. coli or extended spectrum beta-lactamase E. coli. The individuals were then hospitalized and unfortunately one succumbed to this infection. Since that time, additional screening has gone into place at stool banks around the world to prevent further complications, but again, we must treat this treatment with respect. In individuals who have inflammatory bowel disease, we've also seen a slight increase in the risk of flare or worsening GI disease post-FMT. I'd like to close by sharing with you the take-home points that we've covered today. So first, the microbiome in humans plays a critical role in health and disease, and development begins from the moment you're born and possibly even earlier. FMT and microbiome-based therapies may be useful in the treatment of autism behaviors and GI symptoms. However, we must exercise caution as adverse events are usually mild but can be quite serious, especially if that individual is immunocompromised. And finally, and most importantly, more research on FMT, the microbiome, and autism are needed. And with that, I'd like to thank my team, Dr. Sonia Bilal, who you'll be hearing from as well today, Dr. Zhang, who does a lot of our microbial analysis, my research coordinators, Abby Kaplan, Laura Capuccio, and of course, my assistant, Evelyn Mendez, who fields all of the calls from families who want a second opinion.
Stacey, thank you so very much for your time and your input. And I know that for our organization, you do a lot of multi-center work to try to get places that do fecal transplant to work together so that we can get our best data. With that in mind, what can you say about people who are seeking this? They don't want to do this at home. We don't want them to do this at home, but they would like to go forward with these types of therapies. Do you feel like there's enough information out there that people should go forward with these kind of treatments? Or if there are not protocols that are put forward, which is really the case right now, what should families do?
I think that's a really important question. I think one of the most important things that we talked about today was a healthy diet. And although many of us think that eliminating different foods is better for our microbiome, what we've really shown is it's the inclusion of the healthy food groups that really helps our microbiome the most. So for example, a Mediterranean diet has been shown to have a tremendously positive impact on the microbiome. In terms of fecal transplant or microbiome-based therapies for autism, I don't think we're there yet. There is some benefit. It's not clear how much. It's important to remember that these were open label studies, so patients knew what they were getting, and there was no placebo to control, and obviously we can have an impact from an open label effect on a study. What I hope people will do is get more involved with advocacy, get more involved with grassroots research efforts, and collaborate with physicians and scientists so that we can truly collect the data to be able to characterize the microbiome. I have a feeling that it's not a one-size-fits-all. In fact, there's probably multiple different microbial targets that may be important in autism, not just a single. So to assume that one FMT treatment is going to work for everybody is probably a little bit naive. But I am very excited about the future. There is a great resource in the FMT clinical trial, there's a great resource in the clinicaltrials.gov website, which lists all ongoing trials in the United States as well as some abroad. And individuals who are interested in studies about autism treatment can look there and can also search for studies that are including a microbiome-based therapy aspect.
Do you think that there are things that I can do other than look for an FMT site to really alter my own microbiome? You've touched about diet. What about things like probiotics or nutritional supports like prebiotics or fiber, or you name the supplement that I could purchase over a number of websites? How do I integrate that into my regular mindset, or should I?
So I'm a big fan of probiotics conceptually. The idea that healthy bacteria will make you healthier is a wonderful notion. Unfortunately, again, it's probably not a one-size-fits-all. The probiotics that help me may not help you. And there's a lot of variability because they're not actually a controlled substance, so it may depend on how long it's been sitting on the grocery store shelf, and that could really make a difference on whether it makes an impact. Will it hurt? Probably not. And some people definitely feel better on certain proprietary blends or brands of probiotic. And I think it's probably fine for most individuals who don't have other medical problems to take probiotics. And if they feel like they're helping, that's wonderful. I don't see them as a singular treatment to help. If people want to take prebiotics and eat more fiber, I think that can be very helpful. And again, that sort of gets to the idea of the Mediterranean diet where we're giving the bacteria in our gut the right substrate or the right baseline ingredients.
I know that there are some studies that have looked at that question about whether there's a higher frequency of autism in the setting of C-section delivery or the like. And I think those, for me, are still pretty debatable. But we're in a place where more than half of individuals are delivered by C-section. And this paper that you talked about with microbial transplant from mom to the C-section delivered baby is tremendously interesting. Do you know if there's any longer term outcome data around those individuals to say that there is some less frequency of neurodevelopmental issues or food allergies or other factors that have been associated with the microbiome so far?
That's a great question. I don't believe there is. That study is relatively recent. It was published in 2020. So we're kind of just at the end of the time cycle in which we would have meaningful data. Maybe even another year or two would be needed. But I think you highlight an important point, which is not only do we need to think about things we might add, like a healthy diet or whether probiotics or prebiotics are healthy, but what can we avoid? Many people are given a choice about C-section. Of course, in an emergency situation, we want moms and babies to stay safe, and if your doctor recommends a C-section, we should proceed. But elective C-sections are a luxury, and they're not necessarily beneficial to anything except your calendar. So those are the types of decisions that we can control and have a much bigger impact on the health of our children. The other things that we can consider are exposure to antibiotics. Many of us feel that with the slightest sniffle, we want to go to our doctor and we want to ask for an antibiotic to make us feel better. And that's another area where we have an opportunity to prevent exposure to antibiotics, which really destroy the microbiome, and it can take quite some time to recover from that. So I urge my patients that don't go on an antibiotic for a cold. If you have a serious infection and your doctor thinks there's no other options, to go on an antibiotic, limit the time course as much as possible, if it can be 5 days instead of 10 days or 10 days instead of 14, and really to be mindful about the choice of antibiotics so that you are doing your best to preserve the microbiome.
I have one more question I want to ask in terms of that, and that is, it's very clear, as you talked about the predominant organism strains that are important for health. I think that what you foresee coming is people recognizing what are the important strains that are present in that fecal microbial transplant, that there may be really 3 or 4 or 10 or 50 particular bugs that have more value than the entire community being donated. Can you foresee particular targeted probiotics that might do the same thing or might have similar benefits to FMT?
Absolutely. There's a growing field in the study of LBPs, or live bacterial products, and these are defined or curated consortia of bacteria. So individuals have isolated bacterial spores or specific bacteria that have been shown to be helpful. And you can think of them as sort of a super probiotic, and that they are being developed with that theory in mind, that if we know what we need to replace and we can target that specifically, it might be safer as well as more effective. And I think that we're going to see a lot more in that area of research over the next decade.
Thank you so much.
Thank you so much for having me. It was a pleasure.